Good afternoon, everybody. I'm Dr. Vanessa Lopez-Littleton, an associate professor and chair of the Health and Human Services and Public Policy Department at California State University, Monterey Bay. This is a CSUMB Super Saturday event, a series of events organized by the CSUMB Office of Admissions to engage and support the Black community across the Tri-County region. This community conversation is being recorded and will be available for sharing later this week. We kindly ask that you turn your videos off if you're not one of our panelists. Before we begin, I think it's important that we understand the reason we're hosting this event today. As you know, today marks the beginning of Black History Month, a time we remember and reflect on the many achievements made by Black people across the diaspora. In this moment, we recognize the disproportionate impact of COVID-19 on the lives and livelihoods of our Black community. For us, the Black community includes all of us who identify as Black or any multiracial grouping that includes Black. COVID-19 has had a devastating effect on Black families and continues to reveal disparities between Blacks and other populations. While some would argue and challenge the notion or the significance of race, I would challenge you to look more closely at race. As a category of people, we face the greatest risk of illness, injury, disease, and even death. When it comes to COVID-19, Black people experience some of the worst health outcomes, including hospitalizations and even death. This community conversation is geared towards shining the light on Black health disparities and contributes to an ongoing community effort to better coordinate and disseminate public health information. And this is so important as our lives depend on it. Today's program includes 2 spoken word performances by award-winning CSUMB alumni, Christopher Siders, a brief presentation by the Monterey County Health Department, and our panelists, who I will introduce shortly, will take questions from you, the public. But just a little bit of housekeeping. If you have questions for our panelists anytime during our session, please feel free to go ahead and to drop those in the chat. The chat is being monitored by Kobe Davis, a CSUMB student, Stephen Goings, and Dr. Vivian Waldrop-Patterson, both CSUMB staff. To protect the integrity of our session, if you phoned in, you will need to submit your questions directly to Stephen at sgoings@csumb.edu. I'll say it one more time. That's Stephen Goings, and his email address is S for Stephen, his last name Goings, Goings, @csumb.edu. Due to our limited time together, we may not be able to get to all of the questions that you have, but we want to assure you that your questions are important to us, and we want to provide you with a response. We will be working on a Q&A document that we will plan to disseminate in conjunction with the Black Folks Calendar scheduled for release on February the 8th. Now it is my pleasure to introduce Christopher Siders, an amazing young brother who lives in LA County, but thinks of Monterey County as his second home. He is a CSUMB graduate with a BA in Humanities and Communications with an emphasis in social action and creative writing. We are all excited to hear him speak his truth. Chris, you're up. Chris, you're in here?
Okay, yeah, it wasn't unmuting when I was trying to
Okay.
unmute it. All
Yeah,
right.
unfortunately I had to click on it so other people couldn't unmute themselves, so sorry about that.
Oh, thank you. It's all good. It's all good. Good evening, everyone. My name is Christopher Siders, and yeah, I live in Los Angeles County, and I lived in Monterey County from fall 2011 to spring 2018. Shortly after I graduated, I stayed in the community for 2 more years, just doing community work and whatnot. So This first piece I'm gonna do tonight is my experience with COVID. I am a COVID survivor. On paper, from what I was told on my discharge papers, my respiratory and pneumonia. On paper, I'm really not even supposed to be here right now. And I just thank God every day for keeping me here and keeping me grounded so I could share this story and hopefully help others that are in the same predicament as I was last September. So hope you enjoy this piece. God waited for the day I showed up on their footstep empty-handed to present their face. Pink, white, blue. Job once said, naked I came from my mother's womb and naked I shall return. Adjourned under the same roof, Rittenhouse maintained with black bodies used as the foundation to place a wooden table. Where Lana Del Rey attempts to sing the same octave as Hughes, we as black people can never stop running in Aubrey's shoes above underground. The earth wades. As Mother Water breaks levees with every lead drawn out the chamber, seekers flag kneel on curves mirroring Edward Norton as Derek Chauvin or Vineyard C. American history repeats. Present day is like 1918 meets 81 colliding with 92. A new celebrity in chief against blacks die on camera with nothing to prosecute in this realm but our past, fabricated in spangled banners, carried by military death coach chanting bullets, retrieving Uncle Sam's debt. Greed was the engine, looting black bodies for profit, skinning us for the design of their wallets, raping and killing our fathers. So I don't give a damn about Target. I don't give a damn about Amazon. I don't give a damn about Walmart. I don't give a damn about your gentrified coffee shop. I got beef with your local police department. You said fuck the police as a trend and I actually lived it. Holding my father at gunpoint, making my mother watch. I was followed home while they attempt to put cocaine in me and my brother's pockets. It's America that taught me how to kill when disrespected. And it's America that taught me how to lie, cheat, and steal by any means, then create the facade that somehow mountains are being moved by being a damn patriot. Nearly 500,000 dead, and we still dine out the question, the point of it all, like a bad Disney Channel special. I'm truly at a loss for words. 6 feet apart, 3 people to every other row, only 30 people allowed in total at my anxiety that death lingers around every corner, literally living down the street where 18-year-old Andreas Corrado was gunned down by deputies. I found peace to wallow in my negative energies, eventually catching COVID, coughing up blood on my toilet, unable to focus, going to the ER with extreme fatigue and internal bleeding for the first 7 hours, and punctured repeatedly in the morning, alone. Collapsed in the middle of the floor, rushed to the ICU. Doctors offer shock therapy in case my heart stops beating. Relearning how to breathe as I watch Breonna Taylor's killers walk free again. I feel weak. Strapped to the bed, unable to move. When I poop, black liquid would come out and nurses would have to wipe me down. Unable to drink water with the same red Jell-O and ice chips for 3 meals a day. Watching The Price is Right, Young and the Restless, and more protests while doctors struggle to get blood out of me. My heart rate is over 200, thinking about my cousins, thinking about the pain of a black father sitting with the thoughts of burying his son, and the pain of a black mother unable to shield her child. My solid ground begins to crumble, receiving many messages, not understanding what love is, thinking about the many failed attempts of redemption, thinking that somehow I deserve this. Taking the last bit of wind out of me, I can't breathe. Silent shrouds around me, seeing nothing but pink, white, blue, God. Thank you.
Wow. Thank you, my brother. Yeah, it's hard to collect my thoughts and think about following that up. But I do want to thank you for setting our hearts and minds ablaze as we think about your struggle and your journey. Mighty is the spoken word indeed. So before our presentation from the Monterey County Health Department, Mayor Oglesby from the city of Seaside has been invited to say a few words.
Thank you. I want to say good evening to everyone and welcome. I wanted to thank the sponsors of this timely discussion, CSUMB and the Monterey Peninsula branch of the NAACP. And of course, listening to those wonderful words from Chris there really, get you to think about what we're going to talk about over the next, hour or so. It's important that we do all we can to be transparent as we work to ensure African American community receives all the information we can provide surrounding the COVID vaccination. Those of us who are comfortable with the science of the vaccination and how rapidly it came about being approved by the CDC, we must do all we can to push this important information into the community and not just stand back and say, I understand it, I get it, why don't you? So I look forward to hearing the discussion. And again, I just want to say welcome, 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 and thank you for this timely discussion. So thank you so much.
So yes, thank you, Mayor Oglesby. Where am I? So next we have our presentation from Elsa Jimenez, the Director of Health Services at the Monterey County Health Department.
If you may, Dr. Lopez-Littleton, enable me to turn on my video and share my screen.
Okay, try it now.
All right. Awesome. Great. So good afternoon, everybody. Confirm you can see my slides, Dr. Lopez-Littleton?
Yes, we got you.
Awesome. Great. Well, good afternoon, everybody. I'm Elsa Jimenez, and I'm the Director of the Monterey County Health Department. I do have quite a few slides here, and some of them I ask for forgiveness in advance, as I will just roll right through them, as I am limited to about 10 minutes. But I have made these slides available so that they can be shared with the community. So this first one that I'm going to go over is really our local data and metrics. We're currently publishing our data Tuesday to Saturday. So we've only been able to record about 39,000 cases, but we do know that tomorrow when we post our data, we will be bringing forward new cases from Saturday, Sunday, and today. And what we see in these cases is that both the number of cases, the people that are hospitalized, and the individuals that lose their battle to COVID disproportionately impact our communities of color, our Black, Indigenous, and people of color. We recognize that most of our cases, about 46% of them, are concentrated in the city of Salinas, specifically in two zip codes, 93905, 93906, followed by South County, and then the Peninsula Big Sur area, with lastly only about 10 of the cases in North County. And what we tend to see in our cases is that there is rapid transmission within the households. And so really we see cases all the way from 0 to 100 years of age, so to say. When we look at race and ethnicity, and as Dr. Lopez-Littleton said, I think we need to lead with race when we talk about COVID, because there is definitely a sign of disproportionate impact on our communities of color. When we look at California statistics, we see that 4% of our cases are in our Black or African American communities. compared to 6% of our statewide population. When we look at specifically our Monterey County statistic, which is represented on the right by the bar graph, we see that about 0.6% of our cases are in the Black and African community compared to 2% of our population. When we look at severe cases, so these are those that are individuals who have been hospitalized or individuals who have lost a battle to COVID. Again, we see disproportionate impacts. Here we have our African Americans representing 6% of the statewide deaths, again, compared to 6% of the population. In Monterey County, about 2% of our hospitalizations identify them, individuals who are hospitalized identify themselves as Black or African American. And unfortunately, we're not able to report the actual number of fatalities in our Black or African American community because the numbers are too low. We follow a general rule that we will not break out race and ethnicity until we have 5 or more in a specific group, again, to try to preserve the confidentiality of individuals that are impacted with COVID. But if you look at the other BIPOC communities, you see that Latinos are disproportionately impacted, and so are our Asian and other communities of color. This is what we like to refer as an epidemiological curve. You can see from inception when we started to have our first case, which was in the mid-March of last year. You can then begin to see that we started to kind of peak in the early summer months, which coincided with a release of certain restrictions. You know, right away in March when we went into stay-at-home orders, you saw that we were able to keep our case count stabilized. And then we experienced what we thought was going to be our highest peak last summer, but as you can see in the later winter months, November, December, up to just 3 weeks ago, we had our highest peak. We do think that we are actually moving in a positive trend and going down in terms of our number of cases, but it doesn't mean we're in the clear and we can let our guard down. This is showing the hospitalization census in our community. And again, you can see it kind of coincides, the curve coincides with the curve of cases. And the last report that we have was for January 22nd. We had 184 individuals hospitalized in our county. This next slide shows our ICU or intensive care unit bed availability. And the last report we had about 29% of our ICU beds available for support. And you can see that the curve kind of coincides with the increase in cases as well. Now, I want to shift to testing. You know, there is ample resources now for testing. Spread throughout the community. You know, we're partnering with Seaside High School to be able to have a state-sponsored Optum site on their campus. We have a drive-through site in Soledad, and then we also have walk-up sites in Salinas and in Castroville. Our hospitals from the beginning, as well as some of our outpatient primary care clinics, were the first to begin to make this service available, and many more have been added to the list of those that make this service available. And to date, we've provided over 200,000 tests in our community. So once individuals receive a positive result, they would be contacted by the local public health team that is doing case investigation and contact tracing. As you can imagine, with the peak that we experienced starting a couple of months ago, we had to shift and prioritize those cases that we would actually help to support. And the way that we prioritize our individuals is we reach out to those individuals whose lab results have been reported to us within 6 days of specimen collection. Again, that gives us an opportunity to still wrap services around that individual, encourage them to self-isolate if they haven't, make sure that their family members are quarantining, etc. We prioritize individuals that are living in congregate living settings like skilled nursing facilities or other assisted support, because we do know that transmission is rampant in those congregate living settings, as well as when we experience an outbreak. So for example, if we have an outbreak at any of these skilled nursing facilities or our local jail, we will prioritize doing case investigation and contact tracing in that. And then lastly, we also prioritize those individuals who have severe illness. Again, trying to make sure that they have resources and supports that they need to hopefully help overcome the COVID illness. So this is, I won't read through this, but in essence, self-isolation is what is recommended for individuals who have COVID. And they need to stay home, meaning isolating themselves to the extent that they can from other individuals in their house for at least 10 days since they've started to have symptoms. And then individuals that are considered close contacts to that person, and more recently it's been defined as being with somebody who has COVID within 6 feet of that person for a cumulative total of 15 minutes or more over a 24-hour period. Before, it used to be a concurrent 15 minutes, and now it's been expanded based on what we're learning in terms of disease transmission. And for those individuals in our community that do not have access or don't have the ability to be able to safely self-isolate or self-quarantine in their home, local healthcare providers and the health department are making referrals to the Emergency Operations Center to be able to be housed in a hotel room so that they can recover safely. Now I'm gonna, now that I've provided you a little bit of the data and what happens when somebody has COVID, I wanna talk to you a little bit about the state health officer regional stay at home. You may have seen in the news that the order and the curfew was lifted on January 25th. And the reason that this took effect is the 4-week projection for really all of the regions in California for our ICU capacity would be that we would be at 15% or more in the next 4 weeks. And so with that, the state health officer was able to lift the order. And with the lifting of the order, counties, depending on their local metrics, would return to the appropriate tier in the blueprint for Safer California. And Monterey County is assigned to the purple tier. And in essence, if you go onto this website and you type in Monterey County, and you can search by sector or you can see everything that's open. But in essence, what we're able to resume operations for is outdoor dining, outdoor religious services. As we know, some had stopped to do that during, hair shops, barber salons. A lot of our small businesses were able to reopen with some modification. The ability to be able to resume outdoor low contact youth sports. And then for those schools that had been approved to reopen as part of the state's waiver process for those that are pre-K or transitional kinder to 6th grade, they reopened both, and they opened before the regional stay-at-home order went into effect, and they could resume instruction for those grades. Unfortunately, even if they went through the waiver process and didn't resume operations, now they're not able to reopen until our county is at less than 25 cases per 100,000 for 5 consecutive days. And this shows where we are in terms of our case rates. You could see here, again, this coincides kind of with our epi curve. The last report for this was January 26th, and you can see that we are at about 67 cases per 100,000. So if a school, for example, Carmel Unified School District had an approved waiver but wasn't able to resume instruction before the regional stay-at-home order went into effect, then they are not eligible to reopen now until we get the 67 number down to 25 over 100,000. This graph here shows the health equity metric. Again, there are specific census tracts, several which are in the Peninsula area, many that are in North County, Salinas Valley, and in Salinas. As a means of making sure that we were prioritizing resources in those communities with the greatest burden or greatest impact of COVID. So you can see here that the black line or the darker line is the positivity rate for the overall county. So right now, our positivity rate is 16%. And the triangle one is for those census tracts that are in the health equity metric. And you can see that we are at 23. So we have some work to do in terms of making sure that we prioritize testing resources in those census tracts. And now I'm going to shift to another public health intervention that I think is at the forefront of most of our minds right now, which is really vaccination. On the left-hand side, you see that you only have a couple of individuals that are not immunized or sick and contagious, noted by the body in red, and how quickly you can transmit from just a small number of people COVID in your community. That's kind of where we are right now. Our goal is to really achieve a herd immunity, which means that about 80% of our residents 16 and older should be immunized. And so again, you see that even if you have 2 individuals that are infected, when you have more individuals that are immunized and protected against COVID, the disease isn't able to transmit as easily. So again, this is a goal of vaccination, is to try to achieve herd immunity. And we would need over 500,000 doses to be able to achieve that goal with the current 2-dose requirement for the vaccine. So how are we going to ensure that vaccine is prioritized and based on those individuals that are at higher risk of developing severe illness, and making sure that we protect those essential workforces who are at greater risk? So we are following California's COVID-19 vaccine plan. On the left is an infographic that we update on our website, and you can see now that we're vaccinating individuals in phase 1A, and those that are 75 and older under phase 1B. And then we also have posted our local vaccination plan on our website for your review. This is data that might be outdated now, since Mondays at 5, we would have updated this. But we've requested a little over 43,000 vaccine doses. We've only been allocated about 37,000, but we've only received 30,000 of that 37,000 that's been allocated, and a little more than half of those have actually been administered according to the state system. We do know that the state system is not accurate in terms of reporting all the actual numbers of vaccines that are administered, but I can tell you with confidence that the vaccine that's been made available to us has either been administered, is already allocated for second doses for those healthcare workers that received a vaccine earlier in January, or is scheduled for the community clinics that we have going on this week and next week. And these 3 strategies down here are what's being implemented right now to try to get our vaccine out. So currently we assessed how capable are we to ramp up. We have an ability to be able to administer about 17,000 doses per week by all of these various entities. But unfortunately, the number of doses that we're receiving from the state of California is really ranging between 2,000 and 4,000 doses per week. And half of those are allocated for second doses. So we have a lot more capacity to administer than what's being made available to us at this current moment. This is just outlining about half of our workers in healthcare have been vaccinated with their first dose, and our skilled nursing facilities, over half of them have already had an appointment for CVS or Walgreens to be able to come on site and vaccinate their residents and their staff. Now, phase B, I think, is what really where the rest of us who are not in healthcare really fall into. And because of the limited supply right now, we're prioritizing 75 years of age and older. And we have about 39,000 residents that are 75 years of age and older. And at the current supply of vaccine, if we allocated 100% of those new doses coming to our county, it would take us 19 weeks to be able to vaccinate the 75 and older. And as you can see, when we move into 64 to 74, we add in the education and childcare sector, our food and agricultural, and our emergency services, that in order for us to administer 1 dose to the individuals in phase 1B, it would take us about 23 months. Again, the volume of vaccine that's coming into our county is insufficient to be able to achieve herd immunity in a shorter timeline. So when you're eligible, so for those, for example, that are 75 and older right now, they can either call their doctor, or their doctor may be already calling them to schedule an appointment to come in and receive your COVID vaccine. And you can also go onto our website and register for one of our community clinics that we have available. So other supports, aside from making alternate safer housing available for those individuals that need it, is that there's been various agencies, and I understand that they're looking to expand the pool of agencies that can train community members to serve as community health workers so that they can be stationed at our Optum sites and be able to help individuals connect to resources. They can go out into the community and do outreach and education and engagement. They've developed door hangers and are placing in communities that are in those healthy places index census tracts. And really their whole goal is to make sure that individuals know how to access the resources available, you know, linking them up with food bank, linking them up with United Way or any of their partners to see if they qualify for rental and utility subsidies. For the stipend program, when we have that, which I hope to be able to ask the Board of Supervisors for approval to be able to continue that again, a $1,000 income replacement for those individuals that need to isolate and are not going to be receiving any income during that period. And I believe that some of these community-based organizations are also working on the peninsula in terms of doing some of this outreach, education, and engagement efforts. And in summary, you know, as I mentioned, we're not in the clear. Just because the regional stay-at-home order has been lifted does not mean that we can go back to business as usual pre-pandemic. We still have a very high case count. We're averaging about 300 per day over the last 14 days. You know, we know that communities of color are disproportionately impacted, and we've identified several short-term and longer-term strategies in our Monterey County report that can be accessed on our website. And we need to still keep practicing what we know helps to prevent transmission, which is staying home when you're sick, wearing your face covering when you're outside of your household, staying 6 feet apart from individuals that you don't live with, and getting tested if you're sick or if you've you suspect that you may have come into contact with somebody who's sick. And there, you know, is resources available. And I know that there's a COVID-19 community collaborative that continues to look at what additional resources need to be made available to our community. And I think the strongest messages here is, you know, please continue to be patient. We're prioritizing those individuals at greatest risk for severe illness, those individuals that are at greatest risk for exposure because of their occupation. And we need to just continue to stress the importance of increasing the flow of vaccine from the federal government to the state government and to local, so that we can make vaccine available to our residents. And with that, I'll take any questions at the end or whenever that time is.
So thank you, Elsa, for that great presentation. You know, I was looking at the timeline and I was like, oh my God, like this is not okay. Like we've got to figure out a way to do better. So yeah, so I'll stop there. I know that there are a lot of questions on the hearts and minds of those in the audience. And so we want to move on now to our Q&A. I'll begin by introducing or reintroducing our panelists as I direct one question to them, and then we'll open it up to Q&A. Please remember, if you have a question, to place those in that chat box. And you can do that by hovering your mouse over your screen, looking at the bottom where it says chat, and entering your question into that chat area. So first up, I have on my list is Samir Bakhta, and as our first panelist. He's an emergency room physician at CSUMB, and here's his question. As a frontline healthcare provider, can you tell us about what you're seeing in the ER and what you believe are some of the biggest challenges facing the Black community as it relates to COVID?
Alrighty. So I don't think I can start my video here, but no worries. There we go. Thank you. So first of all, Dr. Lopez-Littleton, thanks so much for inviting me to join you. I really appreciate the opportunity to chat with everybody. So what we're seeing in the emergency department is we're seeing sick. We're seeing lots of sick folks. We're not as bad as LA. We're not as bad as Salinas, thankfully, on the peninsula, but we're still seeing lots of sick folks. We're seeing folks that are coming in, they're short of breath, they're fatigued, they're miserable, they're coughing, they say this is the worst thing that they've ever had. And these are the people we're sending home. They're not even getting admitted to the hospital. Those are the folks that we're saying, go home and ride this out because you're not sick enough to be admitted to the hospital. So for those folks who say that this is just a bad flu, it's a heck of a lot worse. That's not even counting the people who need to come in and get admitted. There was one day where we had something like 9 people coming in by ambulance, essentially dead on arrival. I had, I think 2 or 3 in a row one day. And again, that's not nearly as bad as elsewhere in the state, but we're seeing a lot of sick folks and we're seeing a lot of sick people dying. So this virus is real. It's not a joke. It's not a hoax, and it's killing people. A lot of people that we know, and a lot of our neighbors and our friends and our family. So it's been tough. Every day it's a struggle to get people taken care of. It's a struggle just to keep yourself safe. It's a struggle when I come home to make sure that I'm keeping this virus away from my family. And so it's been challenging for all of us. I think for the African-American community, much in the same way as the rest of the communities are most affected, this really tends to target kind of blue collar, hardworking folks, people who don't have the opportunity to work from home, people who can't do their job by Zoom. Those are the people who are affected by this because they're the ones that are out there getting sick. Unfortunately, because of the way that our housing prices are, these folks tend to live in larger multi-generational households. So they're bringing the virus home and they're spreading it all around. The fact that the virus tends to be to infect people before they get sick. So that seems to be the hallmark of COVID, is that this virus will get you and you will be able to transmit it before you feel sick. So when people sit here and say, I'm fine, no problem, I feel great, I'm going to go see grandma, you go see grandma, and then the next day is when you get sick, and when you start having symptoms. But the problem is that COVID is most infectious probably in the 2 days before you get symptoms and the 5 days after you get symptoms. And that's where this is being spread like crazy. And so what we're seeing is people who are working hard, they have to go to work, they can't isolate, and they bring this virus home and they spread it amongst their communities. The other thing that I think COVID's really been getting is that those of us in the emergency department, we see this every day because we see people who don't have anywhere else to go for whatever reason, whether it's insurance or immigration status or what have you. They come to the emergency department because they can't go anywhere else. And COVID seems to reinforce those pre-existing health disparities. I tell people, I said that COVID doesn't have a biologic predisposition for BIPOC. There's nothing in Black people's DNA, there's nothing in Latinos people's DNA that makes them particularly susceptible to COVID. What makes them susceptible is the socioeconomic disparities. And that's what really is getting people. And it just is shining a light and a lens on those disparities in our communities. And the fact that health access is just unequal. So when we talk about what are the biggest challenges, first of all, there's the lack of access to healthcare. There's the lack of trust in healthcare over the years, and then there's fear. But I think in some ways, as Ms. Jimenez pointed out, we're not getting hit quite as hard in Monterey County and on the peninsula necessarily in the African-American community as others. What I am seeing is a lot of fear, a lot of uncertainty, and a lot of doubt. And what that leads to is people not coming into the hospital, not coming in to see their doctor for other issues. So the effect is that when people may not be dying of COVID, but what they're dying of is the heart attack that they could have prevented because they didn't go see the doctor. It's the person that sits here with a little bit of mild chest pain that says, I'll be fine. I don't want to go to the hospital because I don't want to catch COVID. And then they end up with a massive heart attack 3 days later when we could have taken care of them 3 days before. So in a lot of ways that it's not necessarily the COVID that seems to be hitting our local Black community. It's the peripheral effects, the collateral damage, to coin a phrase. The other thing that I think we're seeing a lot of is the effects on children. We're seeing a lot of kids who are more anxious, they're more depressed, they're more, they're hit hard in a lot of ways, not necessarily physical, but more mental. And I think the impact of school closures can't be underestimated. I think that kids are not getting their social needs, their emotional needs, their mental health needs met by going to school, by getting that routine, getting their education. And so in a lot of ways, the effects go beyond the health effects directly and more to the collateral effects. So that's what I'm seeing a lot of. It's a lot of everything, not just the sick, but a lot of the side effects and the collateral effects as well. So I think the thing that we really need to do is everybody, is as hard as it is, and I know it's hard for me and my family, but we got to keep staying the course in terms of our social distancing, staying away, keeping ourselves safe. I think trying to get more testing, and especially more rapid testing, is going to be really critical. This is something I've been kind of advocating for a lot. And I think that we definitely need to get the vaccine out as quick as we can, because I think that's really going to turn the tide. Even with the variants that are coming in, the faster we can get people vaccinated, the faster we can get this virus to stop replicating, the less likely it is to mutate, and the less likely it is to have a more devastating variant that's going to really get people more sick. So I hope that answers the question.
Oh, yeah. You gave us a lot to think about. I love when you talked about that this is not genetic, about some of the socioeconomic components. But one of the things that we know about health disparities is that it's without regard to income, education, or occupation that Black people are still more likely to experience disparate outcomes. So we'll circle back and we'll come back and talk more about that. But I do want to get some of the other panelists in here. And so next up, we're going to talk with Dr. Horn, as I'll refer to her for this call. Let me make sure she's ready to go. And so, Dr. Horn, thank you for joining our panel today. And what I do want to ask you is that as a healthcare provider, as we know, there are historic and contemporary experiences with fear and mistrust with medical providers and with the healthcare system in general. What are some of the fears folks have related to the vaccine, that vaccine hesitancy, which we are hearing so much about? And how do we as a community begin to work to overcome some of those fears?
Okay. I'm trying to open up my video. Okay, I can't get it going, but anyway, I'll just start talking to you. So
Did that help you, Dr. Horn?
let me see.
I sent a request for you to start your video, so.
Can you guys see me? It didn't come up. No, it
Look, all we
didn't
see is black.
That's all I see. That's okay. I don't know what the problem is, but it's okay. So as we know, distrust runs deep. And the distrust, I'd say, it really goes back to Tuskegee. Yeah, Black folks are skeptical, suspicious, and I think that there's good reason for it. And so with the Tuskegee Institute experiments went on for 40 years. People are just concerned about their health care. And then another woman that I thought was really important was Henrietta Lacks. And some people may know about her, but others may not. But this was a woman who, I think it was back in 1951, died from ovarian cancer, and her cancer cells were harvested, they were replicated, they were sold, and all this was without her her knowledge or her permission. So when people hear these stories, they have some concerns. Even within COVID, there was a video I know that I saw of a physician who was complaining of not receiving the right care. I don't think that race is not the what is it that I want to say? The risk factor. It's actually the racism. And so one of the things I want people to think about, I realize these are things that cause folks to be concerned and wondering, wow, do I want to get this vaccine? But I think people need to take a look at the situations themselves. Like with Tuskegee, this was a situation where you had a disease and there was a cure for it, and the cure was being withheld. Now we have a disease and we have a vaccine to help with regards, not so much a cure, but to help prevent this disease. And it's not being withheld. We need people to get this. So we want to encourage it. It's a totally different situation. You don't want to look at the Tuskegee experiment and use it as an excuse, because these two situations are very different. The other things we want to think about is some of the things that was just discussed with regards to social economic status and having other comorbidities. African Americans are much more likely to have some of these comorbidities. And with that, it creates a worse picture should you contract COVID-19. And some of these risk factors we're talking about would be high blood pressure, diabetes, obesity, asthma. I mean, if you're not taking care of these things, then you contract the disease and you have not been vaccinated. Your chances of ending up in the ICU are much worse. I think I read the statistics where over 3.5% of African Americans that contract the disease would end up 3.5 times more of the African Americans would end up within the hospital, and 2.5 times more die. So if we have something that we can take to minimize the risk of ending up in the hospital, ending up in the ICU, or dying, then those are things that we want to focus on. I'll stop right now. I'm sure there's going to be plenty of questions later, but I'd be the first to say that it is really important. I think about my parents and had they been around during this age, just how afraid I would have been for them to come down with this particular disease. And it's so easy to spread and not know it. And having something that's available that can minimize your risk of contracting it, or if you do contracting it, having a mild case, I think is extremely important. So that's all I have to say for now.
So thank you for that. I know there's a lot more questions ahead, so I'm interested to hear as you unpack some of this. I want to hear more dialogue from you as well. So I'm going to skip over Elsa, and I want to go to Clement Miller from SVMH. And I do want to talk about the fact that studies have shown that Black people are less likely to have access to reliable health information and health advocacy when interacting with healthcare providers. And I just want to put in a quick plug here. Like, even when you try to go into some systems to put in, like, to get the vaccine, it still takes a long time. And then, what I found is that even if I put my information in there, I said, I picked the time, I did all the right steps, and then it told me all the slots were full. So then I didn't know what to do. Do I just drop all the information, go back? And so what I want to do is I want to focus in on how has SVMH kind of worked to, when you recognize that systems don't work and things don't fit, what do you do? How do you change or pivot midstream to address some of these types of disparate outcomes or just bottlenecks in systems?
So first, I'll just want to say thank you for allowing me to be involved in this and just to talk to everyone about what our hospital is doing to really make sure that we are treating the entire community. Our hospital mission has always been to provide high quality care, but on top of that, we're really looking at providing health and well-being to the community that we serve. And so we're doing that in a number of ways. I'd say the first thing, to get back to your initial question around just kind of learning from mistakes and making adjustments when we find things aren't working, I think that's an everyday occurrence at our organization. And I wouldn't single us out. I think every organization, once they, if we're willing to listen and hear what's going on and hear where the problems are, then we take the time to fix it. And it's important that we ask and that we listen. There's plenty of examples of, we had processes in place that we then realized, as healthcare workers, we make assumptions on how things work for the general community, just because we have the tendency to look at what we're providing from our viewpoint instead of the viewpoint of the our community or our consumers. So we in our instance have a group that helps us, that a patient advisory council that can help us look at the processes we're putting in place and make sure that they make sense for our patients. I also wanted to talk a little bit about just what we're doing to make sure that the care that we provide is equitable and that there are resources out there for everyone in the community, especially people of color in our community. I'd say there's a couple of things. One is really just making sure that the care providers in our community look like our community, so that when you come in to receive care, you can, you may have a physician that is from your upbringing, or you may have a nurse that is from your community, so that you feel that you're coming to a place that could be, I don't want to say your home, but you can be comfortable enough to where you're open to really kind of understanding the changes that we may be asking our patients to make in their lifestyle to keep them safer down the road. I'd say the other thing we've done, a lot of places, workplaces have put a lot of work into diversity and equity and inclusion training. Really, one of the things our hospital decided we needed to put a lot of focus on after the murder of George Floyd was making sure that we were training our staff to understand the differences that some of us growing up in a community that's not of color would not understand. And would not pay close attention to. So we had our leaders go through an 8-hour training, really actually led by some of the team from CSUMB. Andrea Monroe and Britt Rios Ellis led a training for us. And the goal of that is to then take that in smaller chunks and spread it out over a longer period of time for all of our staff, so that we can all really just understand the differences that each of our patients or history that they come with, so that we can provide the best level of support possible. And then the other thing we've done is we've created a mobile clinic, and our mobile clinic goes out to the community Tuesday through Friday, really in places where we find that other members of the community may be struggling to receive healthcare. It's free of charge to anyone that comes, and we go over things like primary care services can be done there, or simple urgent care services. There's also health education and COVID information that is, or screening that's done at that site. So we're really trying to, one, improve the care we provide in the hospital, and also put a focus outside of the hospital, supporting people so that they actually don't need to come, but taking the care to them, so that they don't have to travel or extend any expense to receive the care they need.
Okay, thank you for that. I noticed that you guys are getting a little long-winded, and now we're getting ready to go to a politician. So I hate to throw this out there. So I do want Tyler to try to just be kind with your time. And so I do have a question for you too. Let me find it if I can. Many folks are experiencing isolation fatigue, and parents whose children haven't returned to the classroom are becoming increasingly frustrated. What efforts do you think are needed to help to motivate and encourage folks to wear masks, if not double mask, and to stay home beyond, what we're giving out from the health department? What else can we do? Our community's response to this.
Absolutely. Yeah. So I like to start off by just giving a little bit of appreciation for having me on here. And I'm just super honored to be on this panel with experts in the industry that can speak to a lot of the health concerns better than I can. But I'm glad to bring a little bit of voice to this from a community-based perspective, and I promise I'll keep my comments relatively short here. So, I'll start off by identifying the first part of your question, which was really about mental health and the impacts that's having. And Dr. Bhakta spoke to that earlier regarding youth, right? Like it is unbelievable the impact that this is having, and we are going to feel this for years and decades to come. So this is quite impactful, and I think that there needs to be some acknowledgement there. Also, being part of the LGBTQ community, right? There's several different intersections that people may be affected with. If you're Black and African, if you're African American and of the queer community, right, you have to deal with that intersection of discrimination and the effects of that. So if you imagine a youth at home with parents that aren't accepting of their sexuality, and not being able to socialize with people outside of the family to find that space of socialization and acceptance of oneself. If you think of seniors, you know, they may not be have the family or the chosen family around still to be able to provide them the support and even the FaceTime call to give them any glimpse of hope. So a lot of people are struggling right now, and I just think it was really important to acknowledge that before going into the mask wearing and the social distancing requirements, which is absolutely important. So when I look at what's being done, I look at it from the perspective of the city of Monterey. And so I know that our library staff, our sports center staff, are working hard to provide programs to educate the community, to provide opportunities for youth to be engaged. And it's actually really interesting to see the types of activities that they create to provide this engagement. And if you can imagine, parents are at home, probably some working 2 jobs, and it almost makes the situation worse, right? Because the parents are right there and the child just wants it, right? You see it all the time when the child comes up to the parent when they're on a Zoom call, but they're not able to give them that attention. So that just kind of adds to the mental health issue. But as far as enforcement, we have our police departments, the code compliance, code enforcement have been going out. Tickets have been issued to businesses and individuals who haven't worn masks in designated areas. So work is being done in this area. And I'd actually pause for a second and just give kudos to the Monterey County Health Department. They get a lot of flack, hit time and time again for doing a horrible job. They have a huge job on their hands. And I think it's important to note that during the last recession, they lost a big chunk of their workforce and never gained it back. And so they're dealing with the reduced staff and have a lot of pressure on them to roll this out. I think they're doing a phenomenal job. And so there's a lot of work being done. Agencies at different levels are putting funding into messaging and communicating, putting TV ads out to really help spread the word. And I think today is also a great opportunity to help spread that word. I'll end with this, right? Everybody here, I was looking through the participants on the call. I recognize a lot of you people. You are on other calls that I'm on, right? So it's like we're the same people showing up. That's great. Keep doing that. Help stay informed about the issues. But what would be great is if you can try to find ways of pulling more people in, right? Because they have networks of folks that they can also communicate the message to. And that's really how we can start building community and really kind of getting more pinch pins in there as far as spreading the word. So I'll end there for brevity. And I appreciate it again thanks for letting me be here.
Yes, and so thank you for that, Tyler, and thanks for giving credit to the Monterey County Health Department. We know that they do work hard, and it's a big task. We know that. So thanks for that. And so Elsa, I had another question for you, but I do want to pivot just a little bit because I saw it pop up in the chat, and people are asking about prioritizing Black folks.
Mhm.
I know that in some communities that they are doing that. They're partnering with churches, they're partnering with stores, even doing like pop-up shops in, different areas. And so really curious about efforts that Monterey County might be doing in particular as it relates to, we'll go with BIPOC, but I'm really more interested in what they're doing with Black people for this call.
Sure. Yeah, thank you for the question, and thanks for the support and advocacy for investing in public health. I think we've encountered why lack of investment has really set us off to a slow start in terms of pandemic responses. As I mentioned in my presentation, there's an equity metric that really focuses on making sure that residents in specific census tracts, which are in the lowest quartile of the Healthy Places Index, are invested in terms of testing resources, and hopefully soon in terms of vaccination resources, because we know that those communities, because of what we've talked about, low income, frontline wages, lack of affordable housing, lack of access to healthcare, residents in those communities are going to fare far worse than other individuals who don't live in communities as such, because of the fact that, like we mentioned, there's been policies put in place that really help to further disenfranchise communities of color. And if we look at our guidelines, the state's plan does have a prioritization in terms of those at greatest risk for exposure and those individuals that are at greatest risk for severe illness. And so prioritizing residents in vulnerable communities, again, determined by those census tracts, could be a local prioritization metric that local health departments utilize when we advance through the tier. So for example, right now we're in phase 1B for 75 and older only. Soon it could be, because of our limited supply, that we may want to even further restrict it and saying 75 and older in these zip codes. And we would be using those zip codes that are in those Healthy Places Index. I think over the coming week, we expect to get more guidance from the state in terms of, again, looking at individuals that are mostly impacted, which tend to be our communities of color. And so for the purposes of this conversation, it would be for those pockets in Seaside and Marina, where we tend to have a larger percentage of our African-American Black residents that could be prioritized as we advance through the age priority group, as an example.
Yeah, so I think also one of the challenges that I have is that even though, we've got the categories, we've got the tiers, it still seems like Black folks are the ones with the greatest risk of dying and being hospitalized. And so it would seem, and I know that they're doing this in other communities in other states, I don't know about California, I don't know about Monterey County. So I guess the question is simply, are we prioritizing Black people outside of, you talked about zip codes, but Black folks aren't a monolithic group who live in specific zip codes. We're throughout the community. So, what strategies are being, done to capture those folks as well?
I mean, I think because we are following the state's plan, we have to try to stay true to the groups that are identified in the different phases and tiers. And I think where we have an opportunity in terms of helping to ensure that our individuals that are at greatest risk for severe illness, hospitalization, help to kind of come to surface. And so, I mentioned we have community health workers. I think at a point where we say, okay, we're going to really ensure that individuals that live in these particular communities that are 75 and older, for example, there could be an opportunity to have community health workers to work directly with community-based organizations in those communities that tend to serve African-American Black residents, to get them registered, get them signed up for a vaccine appointment, maybe working with their community-based organizations to ensure that there's transportation. I know that there's conversations with MST, for example, to be able to provide free transportation to the various vaccination sites. We also hope to be able to work with the VNA, who will then go into low-income senior housing. We have Chispa, for example, that has some housing in the Salinas Valley and the peninsula, there's other low-income housing sites for seniors where VNA will then come into those communities and make vaccine available to the residents without them having to leave their home. And so I think there's a multi-pronged approaches that we're going to do to try to ensure that we reach the harder to reach, which we know tend to be our communities of color, to make sure that they get vaccinated when their turn comes up in terms of our local prioritization schedule.
Mhm. So thank you for that, Elsa. Sorry to have to put you on the spot. You're in the hot seat,
No.
girl. So I did see a note from Mel Mason in the chat about 2 African-American women from Seaside who recently passed away due to COVID-related illnesses. And so I think for a lot of us, this disease it's real. You know, I can't really name you anybody who hasn't experience the wrath, for lack of a better term, of COVID. And so this is something that's very serious in our community. And let's see, one of the questions that's in the chat that I see right now, let me see. Let's go with this one. And Elsa, maybe this one is for you. Maybe other folks can chime in as well. It's about people who don't have access to the internet or computers. And what is like a plan or the approach to help to get them the vaccine or to even get information?
Mhm. So maybe I'll let our healthcare partners answer how they're trying to reach out to their patients that are eligible for vaccine. But for the community clinics or pods, as we call them, points of distribution that are posted on the health department website, mcvaccinate.org. We are in conversations with United Way about the ability of being able to have 211 serve as a point to be able to register individuals for vaccine clinics, again, for those that we're calling pods and that are posted on our website. Additionally, we also see that community health workers, for example, could also help residents get registered and for a vaccination appointment. And then we know that some of our organizations that serve senior citizens in our community, like Alliance on Aging, for example, are also reaching out to their the individuals that receive services from them and helping them try to get an appointment scheduled. So we do recognize that, you know, if you have access to the internet or you have a family member that can help you get registered, that you're at a far greater advantage than somebody who may not have access to that. So we're trying to come up with different means of being able to help ensure that all of our residents who are eligible for a vaccine and want to get a vaccine have an opportunity to be able to register and schedule an appointment for a vaccine. Again, speaking specifically just for those community facing pods that we're setting up, and maybe some of our healthcare partners could talk about how they're engaging their patient population.
What I have been doing is we actually did a report of our patients that were 65 and older, 75 and older. And then we also went and we started making phone calls for them. And before we were making phone calls, of course, they were calling me wanting to know, what are we doing and how can they get a hold of the vaccine? The majority of them that don't have the internet, don't have email, they have had their children help them with regards to setting up appointments. And I'd have to say the majority of them have been successful with getting in that way. I actually had one today that didn't have access with regards to one of their children. They didn't have access to the internet. And I actually was able to go online ourselves here in the office. And we just used our own email for the information to come through. And so she was thrilled. We were able to get her all signed up and able to go. But it did open my eyes to the fact that, wow, technology is wonderful as long as you have it and you're a part of it. But when you don't, it really does create quite a gap that can be very difficult to overcome. But I definitely, the children really have been a huge help in getting their parents all signed up, the majority of my patients.
Mhm. So I do have a quick question about the South African variant. I was listening at a news report today, and it talked about the high rate of transmissibility and reinfection. And so I am wondering about the folks who believe that they've already had COVID-19, and so they feel like they can go out and have a drink at a bar and just hang out with their friends because they've already had it. How do we, and what's like, what do we need to do about that? Because that's problematic, right? All right.
Yeah, no, I think I've been dealing with this just in my own family. We had a bad case of flu back in December, and everybody said, no, we must have had COVID. It must have been COVID. And I said, no, I got the antibody test. We didn't have COVID. We just had the flu. Here's the data. I'll prove it to you. No, it's real. And I think one of the things that's going to happen is people will say, well, I had COVID, so now I'm immune. Not so fast. What we're seeing is that this may end up like the flu, where you have to get a booster every year. I'm hoping that having the infection gives you immunity, but we just don't know. So what I'm personally telling everybody is that if you get COVID and you get the infection, yes, you should still get your vaccine, because the data is showing that the vaccine may help prevent against some of these variants where just getting infected with the wild type virus, whatever it may not be enough to protect you against some of these other strains and these other variants. Moreover, what will probably end up happening is that we may end up getting annual boosters. We may get periodic boosters. Moderna is already coming out with a booster for B117, which is one of the UK variant, I think. But the other thing that's most important is the best way to prevent these variants from showing up is to get vaccinated, because the less that the virus has a chance to replicate, the less likely it is to mutate, and then the less likely that these variants show up. So not only is it important to get vaccinated for yourself or for your family, but it's important to help prevent the virus from evolving and getting worse. So I think that's another really important point to think in mind, that the vaccines seem to work against these variants, but just the act of getting vaccinated can help prevent these variants from showing up in the future.
Well, and
Okay.
jumping back to the conversation about masking, right, and double masking, I think this is really important message to get across, which is even once you're vaccinated, it doesn't mean that you shouldn't go out and you should go out in public and stop wearing a mask. I think all the more reason it's important
Absolutely.
for you to continue wearing your mask, not only to protect yourself, because it is not clear whether or not you can contract the virus, but for your loved ones that are around you, they may have it. We have to protect each other.
Correct.
Mhm. So if you have a question that you'd like to pose, if you could just drop it in the chat and we'll try to get it in the queue so that we could share it with our panelists. Did anyone want to add anything before I move to the next question?
I did just kind of want to jump to Elsa's response too, just regarding the question of what can specifically be done regarding the African-American community, those that may not have access to technology. And I think that relationships are just so important in regards to how this is being done. And again, credit to the county for their efforts in reaching out to communities. It's important for us being involved in perhaps different Black organizations within our communities to connect with the county health department, and they will work with us on making sure that we get the material or whatever it is that we need to help spread the word. So relationships are key to it. And I just, want to make sure that folks know that they can go to the county as a resource to be a partner in making sure that the right folks get the information that need it.
And
So
just to add to that, is that relationships are key, because if you don't have children, but you just know someone who can get onto the internet, that's what I learned today, is that if you have the link, you can help somebody, because the information that goes in is their information, their phone number, but you still can help them get that appointment. And so that's really important to know.
One of the things I'd love to see, and Mr. Miller talked about their mobile clinic, and we have a mobile clinic at CHOMP as well. And, you know, I don't think we're at the point yet where we're ready to do that. But once we're at the point where we have enough vaccine that we can go out in the community and start distributing it, you know, my wife said, why don't you take the mobile clinic and go out to places like, you know, Coutinho Park and Seaside, and park the bus there, where people who can't drive, who don't have transportation, but that they can walk to a vaccine site in those communities. I think that would be critical. And I said, yeah, absolutely. My kids go to school at up in Seaside at the international school. And, you know, I'm sure we'd be happy to put the bus out there and let people walk to a vaccine distribution site in the community, where you don't necessarily have to log on or drive to a site, but just walk there. And I think that would be a really useful, smaller point of distribution. I don't think we're there yet. I don't think we're going to be there yet, unfortunately, for a while, but that might be a later step to think about too.
Yeah, thank you for that. I think people are just a little frustrated because of the lack of information. And the crazy thing about it is that the health department and other folks are putting out information. It's that it's passive, like you have to go to it. It's not something that comes out. Nobody's going actively out to inform groups of people about this. And so sometimes I think that these are opportunities when we can look at our model and say, what's not working and how do we flip these models on their heads? I mean, even if we look at what they did in West Virginia, they didn't just go to like the Walgreens and the CVS and the larger pharmacy. They went to the smaller pharmacies to distribute their vaccines, because that's what they had in their communities and that worked for them. And so maybe a model like that could work for us. So I'm just saying that sometimes it's up to us to begin to challenge the system when the system doesn't work. But the funny thing is, a lot of times people don't feel like they can challenge systems, that they don't have the power to be able to do that. So I do have another question that I'd like to ask, because some people are now, because, you know, with the Johnson & Johnson vaccine that's coming out, people are wondering, should they wait, not do the Moderna or the Pfizer, wait until and just do the Johnson, which is a one dose. Some people are, you know, saying that they don't want to do the the mRNA, that they want to, you know, do another type of vaccine. So I see, Samir, you're shaking your head. What you got?
So get the first vaccine you can. If you can get a vaccine, get it. If it's Moderna, get Moderna. If it's Pfizer, get Moderna. If it's Johnson & Johnson, get Johnson & Johnson, but get a vaccine. It doesn't matter what it is. Before the data came out on Pfizer and Moderna, we would have all been happy with 50%. I'm sure Elsa would say the same. We would have been delighted with 50%. And then when it came out or we said 70% would be amazing. And when it came out to 95%, all of us, I think everybody's first reaction was, no, it can't be real. And then we all looked at the data and said it's real. But quite honestly, even if Johnson & Johnson's 70 to 80%, even if the other ones are 80%, that's great. Just get one. I don't think anybody needs to worry about which one you get. You know, if somebody's walking up to you and say, here, you want a COVID shot? The answer you want to give is yes. Let me roll up my arm and I'll take it night now. So yeah, I don't think anybody should worry about which one to get. You know, we're talking about minor details between the two of them, and just get one, because I don't think anybody's ever sat here and look at their flu vaccine saying, is this a Pfizer or a Moderna? Or no, I don't want that one. I want the other one. You know, I'll take the 2016. That's a much better vintage. No, get what you can get as soon as they give it to you, and take it, because it's the right thing to do.
Perfect. Thank you for that. So there's a question that's in the chat that says, I've talked to several out of state who say they've called and talked with their primary care physician about, and they put them on a call list when they receive the vaccine. Do you think that's the best way at this time to be notified as soon as the vaccines are available? So is it best to contact your provider, or is it best to just get on the wait list that's put out by the health department? I think it's My Turn or something like that. So which one should folks do?
I think both.
Yes, I was gonna
I
say
think
both.
Yeah, I think that, because you never know what information is going to come, and the sooner you can get in, you need to get that vaccine. So both. That way you don't fall, nobody falls through the cracks.
Elsa, did you want to add something, or is that good enough for you?
No, I agree. Both, call your doctor, see if you're 75 and older, see if they're making vaccine available to their patients. If not, see if they're beginning to make a list of when you're eligible. If not, register on My Turn. It asks you very specific questions so that the system then knows when we've advanced into that tier, and you will get notified that way as well.
And
So
if
I
you
do have
don't,
a, go ahead. Go ahead.
I'm sorry, if you don't mind, I wanted to add, one of the key things that I took away from what Elsa was sharing was that the availability of vaccine is low. So I would not wait. I think that's another point we should make sure we make. Because it's low, if there's a chance you can get in line, get in line. If there's a chance your doctor is giving it, call and find out. At our prime care office is going to be calling their patients that are 75 and older. They've created a list, and they're running through that list, sending emails and out as well. But I would take every opportunity you can to get on a list or get in contact with your doctor's office, so that the moment one is available, no matter what it is, you have the opportunity to receive it.
One thing I wanted to mention, no, totally agree, is that one of our pediatric groups, the Monterey Peninsula Pediatric Medical Group in Ryan Ranch, one of the problems with the vaccines is that you have to have a -80 freezer to hold these in, and they actually have the ability to do some storage. So they're actually offering vaccines. The pediatric docs are actually, I was joking with them, one of them earlier, that they're turning into geriatricians because they're vaccinating people over 75. But the website is ryanranchvaccines.com. I put it in the chat. But if you're 75 or older, go ahead and register there. And if they've got supply, they'll get you. So I would register anywhere and everywhere and go to every site you can. Or, if you've got grandma or grandpa, get them signed up too.
Mm-hmm. So thank you for that. Clement, I do have a quick question for you regarding retired nurses and other healthcare providers in the area. Do you know if California is going to roll out a program where these folks would be able to participate in any kind of mass vaccination event that we might have? I know that some other states are doing some programs like that, but I wasn't sure about California.
I would assume that we would. I will tell you that we've pulled back many of our retired nurses to help us provide care here in the hospital, because the number of nurses in our community, or in pretty much every community right now, is low. So I haven't heard that yet for our state, but we've been pulling nurses in and utilizing them. We've been utilizing it, as a matter of fact, nursing students to support vaccinations as well here at our hospital. And I believe CHOMP is doing the same, and I'm assuming Natividad as well.
Okay. Great. So I do want to launch a brief poll. So if you're familiar with Zoom, you should see a poll pop up on your screen. And I'm just going to give you guys just a couple of seconds to scroll through it and click on it. Are you seeing it?
Mhm.
Okay, perfect. Vivian, are you there?
Yes, I'm here.
You didn't know I was going to call on you, did you?
Well, I'm always ready. What's up?
Okay. So is there one question that we can use as a final question before we start wrapping up?
I think that in the Black community, the one question that some people might be a little bit nervous about asking any of the panel folks is, what about pre-existing conditions such as autoimmune diseases, asthma, heart conditions, and things like that? Should people be leery about taking any of the vaccine? if they know that they or their family members have pre-existing conditions?
No, I would think that the folks with pre-existing conditions, majority of them should definitely get the vaccine. When you, prior to taking the vaccine, there's a list of questions where they're asking if you've had any allergic reactions to vaccines in the past. Both of the vaccines on their fact sheet talk about who should not get the vaccine. And none of the pre-existing conditions are listed on there. So when we're talking about those that shouldn't, it usually is someone who may have had an allergic reaction to either one of the components of the vaccine, or who's had an allergic reaction to other vaccines, but not the pre-existing condition. The other thing is I would make sure I talk with a healthcare provider if I have a compromised immune system. They should be aware of that prior to giving you the vaccine. But the vaccine itself is not COVID. That's the most important thing. I think sometimes people are concerned that they're getting the virus, and they are not getting the virus. You cannot get COVID from the vaccine. That's an important statement that needs to be made.
Yeah, thank you for that. So
Yes.
as we get ready to wrap up, I want to thank our panelists first of all, but I'm going to end the poll. If you didn't have a chance to participate on this particular poll, we hope to be able to do it, some kind of event like this in the future. I'm going to end the poll, but as I end the poll, I will share the results with you. Do you see them? You should be able to see the results. That's
Yes.
important to
Yes.
me. We're not going to collect your data and take it somewhere else without showing it to you first. So there you go. So what we see is that most of the people on the call, about 72%, say that they are extremely likely to take the vaccine. There are a couple of folks who've already had the vaccine. So that's a great thing. How likely are you to recommend it? Most folks are. 0% were very unlikely. That's good. I believe the vaccine is safe. There is some hesitancy there. Some folks are not sure, and that's what we want to be able to address. And so if this is a beginning of a longer conversation, then that's fine. We understand it, but the goal is to get people so that they are comfortable. The next question is, I believe the COVID vaccine is effective against COVID-19. Is that the same question? Yeah. So one is safe, one is effective, right? Yeah. And then the last one is about, we really are trying to make sure we capture some voices of our Black community. So we do have about 75% of our participants who are. So I do thank you guys for participating in that, that poll.
Vanessa?
So, yes, please.
Vanessa, just real quickly, you're looking at probably about, 15 or 16% that are unsure and very unlikely. Maybe you could call for somebody what would it take for those people to shift, or just one person from that group that can speak to what they need in order to be more willing to take the vaccine?
So Vivian's throwing me off my timeline. I wanted to make sure that we wrapped up on time, but it's fine. I'm just going to breathe deeply over here. You guys just bear with us. We're going to go over slightly. Anyway, okay.
One
so anybody want to speak to it? Go ahead.
It's 15 or 16% is pretty high. So, overall. So if there's one person that would want to speak to what would help them be more clear about the safety, what have you, with the vaccine. If nobody's out there that wants to speak,
so I have an idea. How about this? How about if you are one of the people who said that you were unsure, that you are uncomfortable, if you would just do a private text or direct message me or Vivian. How about that? And that way you don't have to come out in public and say what that hesitancy is, okay? And so now I want to make sure that we have time so that Mel Mason can have a few words. And so Mel, you're up.
Okay, well, one, I would like to just thank all of the presenters for this very timely, for this very timely endeavor. And it's good to see some of the things that we have been trying to do kind of buttressed by what folks were talking about in terms of how we get people vaccinated. And for me, it's about Black people being confident that this vaccine is okay. We started out at the Village Project last March, immediately beginning to do things like post stuff on our webpage about how to cope with or handle the pandemic, reminding Black people that we've been handling a lot of pandemics, one of which has been racism and oppression for centuries. And so we are going to continue to depend on that resiliency and that strength that we've demonstrated all these centuries to get through this. Now, what we have to do is get the truth about what's happening. And I know that Dr. Samir had read a guest commentary that I had printed in the Herald, in which it talked about Black people needing to get the shot. Also going over that long list of reasons why we have no reason hardly to trust government. The one point that we wanted to make, though, was that we have Black medical scientists and practitioners that had a hand in creating the vaccines. Probably the one that's the most notable right now, because Dr. Fauci talks about her a lot, is Kismet Corbett. So Black people are not going to create stuff to kill Black people. And also, if you want to compare this to the Tuskegee Institute thing that happened, this would wipe out the whole world, because the COVID vaccine is for everybody on Earth. So I don't know whose benefit it would be to kill everybody on Earth. So we still have to do some education. We've been doing a lot, and but I think the big thing that we're trying to do now is to find yet another place for Black people to be able to trust that this vaccine is okay. And that is by working with the historically Black churches in Seaside. And so we've been able to work together and to working with the county to come up with agreements so that these churches can be certified as vaccine sites. And we feel that if Black people see that the vaccine sites are churches as well as other places, that this is going to add to the trust factor. So we're continuing to do work. We are one of the community-based organizations that has been seriously and in a deep way working to make sure that Black people get this shot and that Black people stay alive. So I really appreciate all of the information that I was certainly able to pick up today. That's going to be helpful in our ongoing process of being as helpful as we can to the Black community. And I just wanted to thank you, Dr. Vanessa, for inviting me to be here tonight to partake of all of the wisdom and knowledge that was given out tonight. Thank you.
Yeah, thank you too. And thank you to our panelists. Thank you to the Monterey County Health Department for helping me put this together. I really want to thank the NAACP, Yvonne Thomas, for her leadership and vision and bringing this to fruition. So it's this is a collective effort. And so my hope is that this is the beginning and not the end. There is a lot of work to do with building trust and restoring trust between health, public health, and the Black community. And we know that, and hopefully we're now poised to be able to do something about it because our lives depend on it. So as we end our session, I'm honored to present our closing presentation from Christopher Siders. We thank you so much for participating in this important community conversation. And just to let you know that our session will end immediately following Chris's presentation. So thank you. See if I can find him. Hold on.
Okay, there we go. All right. Hey everyone. I would like to thank the panelists for giving their thoughts and sharing all the knowledge during this time. I would like to echo the importance of mental health, and especially during this time where there's a lot of police brutality and killing of Black folks around the nation with George Floyd, Breonna Taylor, and so on and so forth. So, because being house, my father wanted to grieve some of those deaths through conversation, and my experience with that is I was so numb to it, and there were so many things going on within myself to where I was unable to hold those conversations with him. So yeah, so please take care of yourself and whatnot, and do what you can to keep your spirits up. With this next piece, it's more so highlighting the issues within Monterey County in regards to racism, police brutality, racial profiling, and that kind of vein, to show that we have a long way to go when it comes to being inclusive. And I just wanted to highlight some of those issues within Monterey County and the CSUMB community, because I'm part of that community and I could speak to that and in my experience. So, okay. It's the same old shit with these populace and pigeons. Ignore community mental illness, steal from executive orders in a vicious cycle where professors struggle, underpaid where students hustle, 9 to 5 plus full-time out of a car with stomachs rumbling next to a grave. No rest for the wicked, digging them buried bones above the base of full order cage to elephants, amongst virtue signaling activists that lack empathy and attack the act that change or correlate with canceling. Safe spaces turn to leaders' hubs, deny Black men from flourishing beyond imagination. I just hope admins see color in the Pleasantville being created. Change the campus vision statement from under our nose, no longer to serve low-income families that dream. Strip away the uniqueness that made CSUMB and replace it with a soulless business trope for programs to be considered normal. This innovation you speak of non-exists and blue pills prescribed during orientations. One tablet for fabulous beaches, 2 tablets to glitch out manipulating hotel meetings. My little homies look up to me, so I gotta speak it. Within rhyme and reasoning, question of being an alumni from here is something we're treasuring. I found gold in troubled souls that roam the catacombs for indigo in a home. Return here for fall 2019 and heard of 2 suicides or overdose and witnessed a student get hauled off in the back of an ambulance truck. When are we gonna finally admit that silence is killing us? I'm merely shedding tears from the eye of my storm. If all you see is a violent river, you're missing the source. One mic to broadcast through your radio domes among the moon-shaped pool reflecting rainbows. Hailing thieves to carpe diem. Racial discrimination since 2002, we kept the broken pieces. A Black woman was called the N-word in 2010. Students mobilized against racism. The following year, my professor tried to use my skin color as a genetic makeup lesson, sending the same message Willie Lynch theorized in some minds of UPD, Seaside, Marina, and Pacific Grove police, like Chief Matalone being complicit towards violence towards people that look like me, profiling, driving while Black, walking on the wrong side of the tracks. Monterey County isn't as inclusive as we thought of, as a matter of fact. Time to talk about rape culture and how it affects the Black community. One time, a woman tried to stick her fingers inside me when I was homeless. While I was working at the campus bookstore, a man broke my genitals. And I've been too pressed holding this all in, so I created this poem for you to conquer your own silence. Peace.
Thank you to all. That ends our presentation.